My name is David Lin. I am a pediatric orthopedic surgeon. I'm a senior partner at the Pediatric Orthopedic Center in Cedar Knolls, New Jersey, and I am coming on to 20 years here. Went to undergrad at Cornell University as an engineering major. Didn't like that too much, and then decided to try something different and went to medical school at Mount Sinai Medical Center in New York City. There I found an interest in musculoskeletal diseases and orthopedic surgery, and that's when I went for my residency in orthopedics. Because I like dealing with kids, I decided to do a pediatric orthopedic fellowship in Memphis, Tennessee at the Camel Clinic, where I spent 1 year down south in Tennessee. I've had multiple injuries that have required surgical intervention. I broke my ankle, I had a mass taken out of my hip, and I also had spine surgery, all within the last 2 years. So I do understand the mindset of being a patient and what it's like to being on the other side. In orthopedics, this is a very physical field, it's very hands-on, and as a former athlete with other sports injuries in my background, I kind of had a little insight in how these kids were getting injured and how they were feeling. So I take that experience and bring it to my practice. Whenever a child comes in with an injury, I kind of figure out what motivates them, how they were injured, and how I can get them back to playing sports or going back to their pre-injury levels of activity as quickly as possible. And with kids, we try to minimize surgery and treat most kids with either casting or therapy or bracing rather than going right to the operating room. My greatest patient success story is not necessarily one that comes to mind, but the beautiful thing about our field is that kids want to heal and they want to get back to stuff. So basically on a daily basis, we have a kid who comes in crying and in extreme amount of pain. They can barely walk. You brace them, cast them, or if needed, we operate them. And within a few weeks, we're getting them walking, and we see them back on the field.